All right, so we just threw some pretty promising news at you. One, life could be back to normal-ish come July. Two, new COVID cases in kids are dropping. And three, Moderna's third booster shot can possibly help protect us from the virus variants. But even with all this good news, some people, they are still hesitant about getting the vaccine, among other things. So in a new segment we are introducing to you called Healthy Skepticism, we are bringing in former FDA Associate Commissioner Peter Pitts every week to break down health and medical news. And since we're still in the middle of the pandemic, that's what we're going to stick with today. Peter, good to have you back with us. So how do you feel about the CDC's projections come July? Are we getting ahead of ourselves? Because that is literally in 2 months.
Well, there's a lot of good news, but it really depends on our own behavior. We certainly have enough stockpile of vaccines. We're going to be introducing vaccines for children relatively soon, but unless we actually get the vaccines, it's just talk. We actually have to get the job done by rolling up our sleeves and getting vaccinated and being responsible, as you mentioned earlier. I think a key point here is that we have to recognize that it's our responsibility, our civic responsibility, our patriotic responsibility to do the right thing. And I think Americans are getting ready to step up to the plate. I applaud the CDC for being positive. I think positive news motivates people to go forward and get the job done. So good news on the horizon, but a lot of work yet to be done.
Absolutely. But what do you have to say about the demand for vaccines currently dropping?
Well, it's very troubling. Vaccines right now, I think we're hitting about 1 million a week, and that's way down from where it was even a month ago. I think people are starting to get a little lazy because they see things opening up. They go, well, things are opening up. I don't really have to get vaccinated. I can take off my mask whenever I want. And that's not the case. These protocols are very important to understand in context. If we want to go outside, if we want to take off our masks, if we want to socialize, as the CDC is encouraging us to do, we must be vaccinated. All these things work together. It's a team effort, and unless we do the right thing, we're not going to be able to move forward. And more dangerously, we'll do the wrong thing, and infection rates will go up. Variants will get a stronger hold, and we'll be back to where we were about 6 months ago, and that's clearly not acceptable. So while the good news is there, and we need to be happy about that, we need to recognize that unless we do the right thing, it's going to go back to the way it was, and that those dark days are not anything we want to repeat.
Right. And keeping all of that in mind, Peter, this projection by the CDC, it does come after President Biden just put out a new goal to have 160 million vaccinated people by July 4th. Currently, there's about 105 million people that have the shots. But what do you think about Biden's new plan moving forward?
I think that it's an achievable goal. And I think an important, kind of rhetorical detail here is that he said adults. And I think what we're going to add to that mix relatively soon are children ages 12 to 17. And that's about 20% of the population. So as we add more people who are able to get vaccinated, we're going to move more swiftly towards herd immunity, which is another crucial issue. I believe that we can reach herd immunity by Labor Day, at which point we really are in control rather than the virus. We'll see infection rates dropping through the floor, and death rates as well. So that will really indicate that we're winning the battle, and that the virus is close to being defeated.
And speaking of children, this goes into my next focus on the Pfizer vaccine, right? The FDA is expected to approve emergency use of Pfizer's vaccine in kids 12 to 15 years old as early as next week. But what do we know about the process to get here?
Well, first of all, that's leaked information from the FDA, which is never good. You never want to leak information on a product, even if it's good news, because that kind of smacks of politicizing the FDA. So we have to be a tad cautious there. But I'll be optimistic and say the FDA will probably approve the Pfizer vaccine for ages 12 and up, certainly by mid-May. And that's important because we want kids to go back to school. We want to get back to life as normal. And unless our kids are vaccinated and back in school, that's not going to be possible. Obviously, parents are going to have a lot of questions. I think that even though, at least initially, childhood vaccinations will not take place in pediatricians' offices, they'll probably take place in school gyms and cafeterias and other vaccine clinics. We have to recognize that people trust their pediatricians. And if parents have questions, tough questions, important questions, legitimate questions, they should pick up the phone and call their pediatricians. They're always there. Pediatricians are the experts when it comes to childhood vaccines more than anybody else. They know the right answers, and they're trusted. And that's crucial that we point people who are a little iffy or skeptical about getting themselves vaccinated or getting their kids vaccinated to the healthcare professionals.
Got it. That's a good point there. Talk to your doctor if you are skeptical and you still have a lot of questions. Staying on Pfizer, just this morning, the company announced that it's going to provide vaccines for athletes participating in the 2020 Olympics and Paralympic Tokyo Games. Do you think this will give greater coverage worldwide to most countries, who have yet to authorize emergency use of the vaccines? And considering that Japan may be extending its state of emergency with coronavirus, do you think this will also help ensure that the Olympics could still begin on time on July 23rd?
On the one hand, I think it's terrific that Pfizer is going to donate vaccine for athletes. The Olympics is an event that brings the whole world together every 4 years, and I think it's important that it happen. But on the other hand, there are a lot of people out there who aren't Olympic caliber athletes who need vaccines. Right now, we're debating whether or not patents should be waived for vaccines. I think that's a bad idea for a variety of reasons. But I think that the more that companies such as Moderna and Pfizer and Johnson & Johnson and AstraZeneca can do to widen the reach of the vaccine globally, the better. And I think that giving vaccines to the athletes at the Olympic Games is a good start to raise awareness relative to the efforts these companies are making to vaccinate the entire world.
Okay, back to that point. You say you think it's a bad idea. This comes as President Biden faces pressure to address kind of the COVID-19 surges happening all around the world, like in India and South America. And he said that he does support waiving patent protections for vaccines. Why do you think that's a bad idea? What does this mean for the U.S. and for other areas of the world, Peter?
Well, the bottom line is that, waiving patent rights for vaccines isn't going to put one initial vaccine into one arm anywhere in the world. Manufacturing these vaccines is highly complicated, both for manufacturing and material and training staff. And the companies that are manufacturing the vaccines now have pledged to supply the world with vaccine at an affordable price. By waiving intellectual property and patents, basically the message that President Biden is sending to innovator companies here in the U.S. is spend time, spend money, take risk, and they're not going to give you patent protection. If these companies weren't doing the right thing, I would say that may be a good threat to use, but they are doing the right thing. And it's strange that people that partnered together to develop diagnostics and therapeutics and vaccines with the government are now being punished by the government. It makes no sense. And I think it also, relative to what happens next with variants and booster shots and next phase development of COVID products, it says to industry, maybe you don't want to take the risk to develop these products because the government isn't really a reliable partner. It sends a bad signal. It doesn't advance the public health. I think it's a bad decision. And I think ultimately it will be rescinded.
Okay, so from patents to incentives, how do you feel, Peter, about the incentives being given out to go get the vaccine? For instance, New Jersey's beer for a shot program, you get a free beer. There's some companies out there giving their employees extra cash and bonuses for actually going to get the shot. Do you think that this puts the United States in a good light, these incentives to go get the shot, put us in a good light to other countries and other areas of the world?
Right now we are the shining beacon for the whole world. The world is looking at us, and we're opening up our cities, and we're going to baseball games, and we're going to have July 4th fireworks and barbecues, and they're wondering, gee, what did we do right? And obviously one was incentivizing companies to develop these products. But I think Americans understand that we play a part in solving the problem. It's not just science and technology. We have enough vaccine in stock right now to vaccinate the entire country. And I think that the rest of the world is wondering why people in the U.S. who are not yet vaccinated aren't lining up to be vaccinated. And whether it's free coffee or beer or free donuts or a savings bond or an extra week's pay at work, I think that the more creative we can be on the national, state, local level, private industry needs to get into it as well, the better off. We need to push people over the finish line. Incentives plays a role, but I think the real incentive, the real winner here is educating people as to the value of vaccines. Education, 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 truthful, transparent, and honest.
That's a good point there. All right, Peter Pitts, thank you as always for breaking all this down with the coronavirus pandemic. We appreciate you.
My pleasure. Stay safe.